A very sad incident indeed, but we're now being joined on the program by the Commissioner for Health, Kwara State, Dr. Raji Razak. Thank you so much for joining us on News Across Nigeria.
Hello, good evening.
Good evening. Now let's start with a sad incident at the University of Ilorin Teaching Hospital where a ventilator was actually turned off on a patient after workers downed stools. Now, I know everyone has a right to demand for their own rights, but at what cost?
Industrial action in the hospital setting is not something that is very palatable, but at times it does happen. As a state, we have a well-structured healthcare system at the state level where our primary healthcare systems are working well. Our secondary healthcare systems too are working very well. We currently have a tertiary institution, that is our teaching hospital. Even though sometimes last week they had, they had to go on industrial actions by JOESU, Joint Health Workers Union, probably to negotiate some demands. But now they are back fully. Whenever they go on strike like that, it has a negative impact on the patient, and we don't want to encourage that. And negotiation is very, very key in order for patients not to be at the receiving end.
You just said you do not encourage that. So in your own opinion, does this not go against the ethics of the profession, which is to save lives?
Yes, the ethics says we should save life. The ethics equally respect the patient and to satisfy the patient fully. Patient autonomy, confidentiality is also there, and non-malfeasance and benevolence for patients is actually very key. But health workers too, they have the right to demand for what they are entitled to. And I think negotiation is very key. If there is regular dialogue and there is effective communication between the employer and employee, it would avert some of these industrial actions that might not actually be necessary.
All right, but in a situation of an industrial action, are patients not advised to seek medical help elsewhere? Do you think that things could have been done differently?
Yeah, like I said, we have a workable system. At the state level, we have our secondary care facilities working perfectly well. We are not on strike at the state level. If there is any industrial action going on at the tertiary institution like teaching hospital, I expect some level of referral to state-owned secondary healthcare facilities. Our primary healthcare facilities are functioning well. We have good leadership in Kwara State now, where everything is working perfectly well. And our secondary healthcare facilities, they are actually working very well. I expect even if there is industrial action, which at times could occur, at times it could happen, I expect some level of referral to our secondary healthcare level so that we can save life.
All right, but how concerned is the Kwara State government? I know the University of Ilorin is a federal government establishment, but it is still sited in Kwara State. Is the government doing anything to pursue this at a higher level?
Yes, we have a very good working and harmonious relationship with our teaching hospital. As I'm talking to you, I'm one of the board members by the virtue of the fact that I am a commissioner for health in Kwara State. And on more than 2 occasions, the institution has visited His Excellency, the Executive Governor of Kwara State, and our governor made some pledges, and by the special grace of God, he's going to deliver on his promises to them. We have a very cordial relationship, between the state and teaching hospital.
Okay, thank you very much, Commissioner for Health, Kwara State, Dr. Raji Razak. Thanks a lot for your time on News Across Nigeria.